All right, students, welcome to Chapter 5. We're going to move right along here. Some of these concepts are going to be pretty familiar to you as we have gone over some of these things in the first chapter or two. But this is where we're going to get into a little bit more in depth. We're going to talk about behaviorism and classical conditioning, operant conditioning, observational learning, and kind of how we learn. All right. So we're going to lead this off with behaviorism. Okay, behaviorism means they're saying, how do we learn? A behavioralist like myself will say, how do we learn? And learning really is a systematic change in behavior as a result of experience. And I mean systematic meaning if A, then B, if A, then B, if A, then B. It kind of happens very systematically. Okay? We use things like associative learning concept. This means we are linking the relationship between two events, thunder and lightning. Okay, they're related. I see lightning, I expect to hear thunder, or vice versa. So we're associating two concepts to help us learn. We've talked about Pavlov a bit. This is the classical conditioning concept. Classical conditioning, I want to be clear about this. The difference between classical conditioning and operant conditioning. Classical conditioning is nothing more than pairing two or more stimuli together. I get a shot, I feel pain. Therefore, as soon as I see the needle, I start to expect pain. Okay? The stimulus, the response. Okay? The shot, the pain. I don't need somebody to give me a cookie or spank me after the shot to positively or negatively reinforce that. The stimulus is enough to condition me. Operant conditioning was B.F. Skinner. We talked about this. This is the consequence and reward system. Behavior is either encouraged or reinforced or discouraged and punished. Okay? Again, this speaks to classical conditioning occurs naturally, and operant conditioning is a conscious process. It's good at explaining operant conditioning, the reward and consequence or punishment is good at explaining voluntary behavior. Voluntary behavior. Okay, my decision to do well on an exam. Okay, I'm rewarded with an A, a good grade, a scholarship. Maybe my parents buy me a new car, whatever it is. Okay, operant conditioning. When we're talking about classical conditioning, we're talking about acquisition of particular behavior through the unconditioned stimulus and the conditioned stimulus. Okay, again, think about Pavlov's dogs. We've talked about this earlier. Go back and re-watch the previous video if you need to. A couple of concepts that are important in classical conditioning. One is contiguity. Okay, this is consistent. Conditioned stimulus and unconditioned stimulus have to be paired very close together so that the person who's learning is associating those two things. They're very important. The unconditioned stimulus and the stimulus. So the food and the bell had to happen when he's bringing, again, the research assistants are bringing the food to the dogs, and the dogs are salivating. That's a natural thing. But we're trying to get them to salivate at the sound of the bell. So initially we have to do the bell and the food together. That's contiguity. They have to happen consistently in order for the dogs to learn that the bell eventually will mean food. Contingency. The conditioned stimulus, the bell, must precede the unconditioned stimulus, come right before the unconditioned stimulus immediately, and must also be a reliable indication of the unconditioned stimulus. So it's got to happen every time. I can't ring the bell and not bring the food. I can't bring the food and not ring the bell. These things have to happen consistently. All right? Generalization. This is where people respond. The concept of generalization means that people will respond similarly to conditioned stimulus globally. So if I was to ask you what a red light means, you would probably say, well, it means stop. Okay, well, it's just a red light, but you have attached a meaning to red light, meaning stop. So you globalize that. Whenever you see a red light, you prepare to stop or to cease whatever activity you're doing. Okay, that's generalization. Discrimination is responding differently to similar stimuli. So you pull up to a stoplight, and even though there's 3 lights up there, you're able to distinguish that each of the lights, that's a similar stimulus, not the same, but a similar stimulus. You're able to distinguish red means stop, yellow means caution, green means go. Okay, you're discriminating between similar stimuli. Extinction. Extinction is the weakening or loss of a conditioned response. I'm going to give you an example here. I'm going to go through a couple of terms, and I'm going to give you an example of what I mean. So extinction is a behavior that we're trying to get rid of. The concept called spontaneous recovery, this means with no further conditioning, after we have gotten rid of a behavior, for whatever reason, this conditioned response comes back, and it comes back in full force. I'll give you an example. One of my patients was a 5-year-old little boy, and this boy had gone through a particular trauma and was engaging in this particular behavior that was very undesirable. It was socially undesirable and was very disturbing. It took about 2 months of therapy and using classical conditioning to get this kid to stop doing this particular behavior. And it did. That's called extinction. We got rid of this behavior. And then it was about 2 months later, for no particular reason, he started doing it again. Just a couple of times. That's called spontaneous recovery. Nothing happened. The behavior just came back. I was able to immediately get that behavior to become extinct again, and luckily he hasn't had any relapses since. Okay? I've already talked about how classical conditioning is good at explaining involuntary behaviors. Okay? There's a process called systematic desensitization when we're talking about a process called counter-conditioning. So conditioning means through a series of behaviors, or over time, I have learned to respond to something in a certain way. Okay? Let's say, for the sake of argument here, I have learned to become afraid of spiders. Maybe a big spider crawled into my crib as a kid and scared the living bejesus out of me, and to this day, I can't even talk about spiders without having an anxiety attack, an episode. Okay, this is also known as a phobia, okay, arachnophobia. To treat these things, I need to counter condition you. Counter means to do the opposite of what was conditioned. So I need to get my patient to be not afraid of spiders anymore. This is done through a process called systematic, meaning very planned, very organized, very deliberate, desensitization. I'm desensitizing him or her to that particular stimulus, in this case the spider. So patient comes in, and first we're going to talk about spiders. I'm going to measure this patient's anxiety level, and as they start to go up, there's a certain threshold I'm not going to let them get past from a health standpoint. But eventually I'm going to be able to have a conversation with this person about spiders, an extended conversation about this person without having them freak out. Then maybe I'll have them come into the office, and I'll tell them I've got a picture of a spider on the wall, and their anxiety level is going to peak. Okay? But eventually, over a period of time, I'm going to be able to desensitize them to that picture. Then the next time they come in, maybe I've got a picture of the spider on the desk. Then a real spider. Then I have them touch a spider. Then I have them hold the spider. Okay, so that's systematically desensitizing them, counter-conditioning them to not be afraid of that spider anymore. There's also a process called adverse conditioning. This is used in treating things like paraphiliacs. Paraphiliac is someone who gets sexual gratification from a non-traditional source. Pedophiles, shoe fetishes, clothing fetishes, things like that. And what we would do in this case is, if we have a pedophile, we would put them in front of this television screen and have this machine in front of them that would, what the machine does is it puts out this real noxious fumes. Noxious meaning toxic, not harmful, but certainly something that's going to make them feel very sick, very nauseated, very unpleasant stimulus. Okay, so we're gonna sit them down in front of a computer, and we're gonna have them pictures of people swimming. Okay, nothing. A picture of a tree, nothing. A picture of a dog, nothing. A picture, not a provocative or inappropriate, but just a picture of a child. And every time a picture of a child comes up, the pedophile is going to get this real noxious odor, sensation, whatever. And we're pairing this noxious odor with a source of inappropriate sexual stimulation for that patient. And eventually we're trying to get them to become attracted to more appropriate, socially appropriate sources rather than just children. And that's called adverse conditioning. All right, switching gears now. That was all classical conditioning. We're switching to operant conditioning. Classical conditioning, good at explaining involuntary behaviors, things that we're not choosing to do, where operant conditioning is good at explaining voluntary behaviors. We have, in your book, you'll see this E.L. Thorndike's, which was a researcher, what we call the law of effect. And it's very basic. It basically says that behaviors that are followed by a positive outcome, I do something and something good happens, strengthens the likelihood that it increases the likelihood I'm going to repeat that behavior. And behaviors that are followed by a negative outcome are weakened, and I'm unlikely to do those things again. Okay? I want you to read E.L. Thorndike's puzzle box, and it showed how learning occurred, and it basically put a cat in a box, and the cat had to do this, do a series of maneuvers to open up the box, and every time the cat would do something and the box would open a little more, the cat was able to go through the series of progressions and eventually get out of the puzzle box. There's a process called shaping or chaining, depending on which researcher you're talking about. But this is very important in shaping behavior, and I use this every day when I'm trying to shape a child or a family's behavior that I'm working with. Think of a link in a chain. And that's really what we're doing. Every link in that chain is a very specific behavior. Now, the goal might be, let's say, for example, I want to get a bear to ride a tricycle. You're thinking, how on earth are you going to get a bear to ride a tricycle? But we've all seen a video or a cartoon or whatever, and we've trained bears to ride tricycles before in society. You see them in the circus. You see elephants get on top of the big beach ball or whatever. So how did they get that to happen? And then what they did is they used a process called shaping or chaining. So first, I would put a tricycle in a huge cage with a bear. And that's the only thing I'm putting in. Every time the bear starts to approach the tricycle, he gets a reward. Okay? We can throw a lot of food out, whatever. The bear starts to associate. The closer I get to this object, the more rewarded I get through behavior. Now the bear's touching the tricycle. Even more rewards. Okay? Greater rewards. Now he's touching the handlebars with his paw. Bigger rewards. Now both. So through this process called chaining, each of these specific behaviors is a link in the chain, and at the end, we've got the desired behavior. The bear's riding the tricycle, sad as it is. Okay? Explaining the concepts of positive and negative reinforcement and punishment are going to be critical for you to understand. Okay, and let me explain it as the book explains it here. You have positive reinforcement, negative reinforcement, positive punishment, and negative punishment. Think of the positive. Whatever I'm saying positive, I'm applying something, I'm giving something, I'm doing something. Whenever I say negative, I'm removing something from the situation. Reinforcement means I'm increasing the likelihood of whatever's going on. I'm trying to increase the likelihood that that behavior is going to continue. If I'm punishing it, I want whatever's going on to decrease. I want it to stop. Okay? Here's some examples. There's 4 different concepts. Positive reinforcement. A student does well on the test, so I give you an A. Or I give you an A. Okay? So you did something good. I'm increasing the likelihood that you're going to repeat that behavior. That's reinforcement. So I give you an A, or I give you a treat. I give you money, whatever. That's positive reinforcement. Negative reinforcement, let's say I say, if all of you guys, all of you students in this class, if all of you get an A on the next exam, I'll waive the final. Okay? I want to increase the likelihood that you're going to all get A's on the exam, so I'm removing something that you don't want. That's the negative part. I'm taking something away to increase the likelihood that you're going to that you're going to keep getting A's and keep giving good effort. That's negative reinforcement. Okay? Positive punishment, spanking, grounding, any of those things. Grounding, don't let I'm removing privileges from you trick you. That's not what this is. I'm applying grounding. Okay, grounding is a positive punishment. I'm giving you restriction. Negative punishment, I have 2 kids in a room who are fighting over the toy. Okay? 2 kids in the room who are fighting over the toy. I take the toy away, so that's the negative part, in order to decrease the likelihood that they're going to keep fighting. Negative punishment. Okay? Positive punishment, I'm spanking a child because they hit someone else. Spanking's horrible, by the way, don't do it. I'm spanking a child because I want to decrease the likelihood that they're going to keep hitting, which is really odd. Stop hitting. Really conflicting message to you. All right? In operant conditioning, I want you to be aware of primary and secondary reinforcers. Primary reinforcers are things we need. Food, water, sex. That's a primary reinforcer. Secondary reinforcers are things that we learned or have to be conditioned that are rewards. Money, promotions, praise. Those are all things that are secondary reinforcers. We don't need those things to live. Okay? We have to learn that those have value. All right? You will need to know schedules of reinforcement. Okay? There are 4 concepts here, and they're interchangeable. Fixed, variable, ratio, and interval. Okay? Fixed meaning it happens every so often. Okay? Variable meaning we don't know when it's going to happen. Interval means time, and ratio means number. So let me give you all 4 examples and combinations here. A fixed interval means every 5 p.m., every day at 5 p.m., I have dinner. Okay? It's fixed. It does not change. Every day at 5 p.m., I eat dinner. 5 p.m., that's the interval part, time. A variable interval would be like a pop quiz. It's not every day. It's not every class. It's just don't know when it's going to happen. Okay? And it's time because I don't know. It's just could be every week, every day, whatever. Fixed ratio means like every 5th person that comes into class wins a prize. Every 5th. 1, 2, 3, 4 prize. 1, 2, 3, 4 prize. 1, 2, 3, 4 prize. That is a fixed ratio. Ratio because it's a number. Okay? Every 5th person. Variable ratio means we don't know who's going to get it, but I know it's 1 out of every 5 people who come in the classroom. So it might be 1, 2, prize, 3, 4, 5. Prize, 2, 3, 4, 5. 1, 2, 3, 4, prize. So 1 in 5 people are going to get a prize, but it's not the same number of person every time. That is a variable ratio. Okay? And as we get into later chapters, we're going to talk about the concept of immediate reinforcement versus delayed reinforcement. But I do want you to understand that in order to successfully learn most any behavior, Okay? Two things have to happen. Think about training a dog or even a child, because the manner with which we approach from a behavioral standpoint, how we train kids or dogs or animals, is the same thing. If I'm trying to get my dog to sit, okay, or I'm trying to get my child to sit down and do their homework, either way, how effective is it going to be if I say, all right, dog, sit, and I'm showing them a treat, sit. So they'll sit down, and then you give them the treat. Eventually, if you do that long enough, they're pairing, if I sit, then I get a treat. If I sit, then I get a treat. If I sit, then I get a treat. Eventually, you'll be able to do that without the treat. That's how we condition. Operant conditioning works. It's done through reinforcement. How effective would you be able to train your dog, your child, whatever, to do anything if it was sit, get a treat, sit, nothing, sit, nothing? You're taking away the motivation for the person or the object that you're trying to teach. Okay? Rewards work best when two things happen: when they're consistent and they're immediate. The reward has to immediately follow the behavior. Reward doesn't have to be something tangible. The reward can be praise. Okay? The reward can be good job, attention, great, but acknowledgement of the behavior. Okay? So it has to be immediate and it has to be consistent. You have to do it every time. You can't do delayed reinforcement and expect it to be effective. If A, then B. If A, then B. If A, then B. If A, then B. That is effective learning. That will happen quicker. All right. I want you to know Albert Bandura. You will need to know this for the exam. Albert Bandura was a brilliant researcher, and he said, how do we learn? We learn through observation. Okay, we learn through what we call modeling. Okay, parents learn. I say please. I have a 5-year-old son. I say please to my son, not because I have some driving need to say please to my son, but why do I say please to my son? Right, I say please to him because I want him to say please. I'm modeling proper behavior for him. That's what parenting is, by the way. You ever want to know, parents go, how do I get my kid to be nice? And how do I get my kid not to yell? And how do I get my kid to do whatever? And I said, be that person. Because your kid can't become anything without you. Model for your child what good behavior is. There's also a process called vicarious learning. Vicarious learning means I'm not doing it because I went through the experience myself. It means I'm learning by watching you. So I'm watching somebody. I want to learn how to make. I want to learn how to be a bartender, for example. So I'll go to a bar and I'll just watch what bartenders do, and I'll watch what process they go through. I'll watch how they mix things up. I'll watch the sequence of events. I'll watch how they deal with the customers. I'm watching through learning. That's vicarious learning. Vicarious learning, not so effective, by the way. Experiential, which just means experiencing or doing things, is much more effective than vicarious. But Albert Bandura said that there's 4 things that have to happen in a very specific order in order for us to learn anything. And the steps are this. The first one is attention, then retention, then motor reproduction, and then reinforcement or consequence. And here's what that is. Let's say I want to learn how to build a sandcastle. So I'm on the beach, and I have to see somebody else do it first. I can't reproduce something that I have never seen before. I can't do it. So somebody would say, I'm watching a kid on the beach, and I see he's got the bucket, and he's packing the bucket with sand and water. He's turning it upside down, and I'm watching him do all the sculpting and stuff, and I go, okay. So I'm paying attention. Then I have to pay attention long enough to remember it. That's the step 2, the retention, the memory. Then I've watched this kid long enough. I remember exactly what he did. Now I have to go do it. Now I'm building it myself. So I'm building the sandcastle, and learning doesn't occur until I have the 4th step, which is reinforcement or consequence. Now the reinforcement doesn't necessarily have to come from someone else, but usually. Okay, so I have to stand back. I'm all done with my sandcastle. I look back and I go, that's horrible. That doesn't look anything like the kids. That would be a consequence, even an internal consequence. Or I'd ask somebody else, how did I do? And they'll go, terrible. Try again. So I back up to the motor reproduction and I keep doing it until I get it right. Therefore, and then I can ask somebody, how did I do? You did great, awesome, great. I have learned how to build a sandcastle. That is Albert Bandura's observational learning model. Attention, retention, motor reproduction, and reinforcement or consequence. Okay? All right. The last concept, just understand you're going to hear me talk about goal-directed behavior a lot. This is from a behavioral standpoint. Goal-directed behavior means that anything that we do has some kind of purposefulness to it. I'm doing it for a reason. Even if I'm doing nothing for a reason. I'm doing it to relax. I'm doing it for my own mental health. I'm doing it because I don't feel like doing anything. Not everything that we do, not all goal-directed behaviors, not all goals are good goals, certainly. If I'm yelling at someone or I'm fighting with someone, there's a goal there that I have internally, whether or not I'm actively thinking about it. But understand that when I talk about goal-directed behavior, we've talked about the black box in the field of behavioral psychology, and again, the black box is what's going on in your head. Color it black. Don't matter, don't care. I don't care. Behavioral psychology, for the most part, this is a gross generalization. For the most part, I don't care why you're doing something. I care that you're doing something, or if you're doing something. Okay? I don't care why. My wife doesn't care that I love vacuuming. She just wants me to get to vacuum and go do it. She doesn't care if I mumble under my breath the whole time and do it. She cares that I'm vacuuming. Go ahead. Cuss up a storm or hate me while you're doing it, but I care that you're getting it done. That is a gross generalization so you can understand the point of what behavioral psychology is. Strictly behavioral psychology. And there is a vast difference between behavioral psychology and cognitive behavioral psychology. Cognitive behavioral psychologists very much care about your thought process. Okay, behavioralists do not. All right. I hope that answers some of the questions that you guys have had here. Wow, that video got really dark. About Chapter 5. Any questions, please let me know, and I will try to turn the light on next time. It got dark while I was lecturing. Take care. Bye.